Hi everybody, this is Dr. Zager from Paloma, and our first question today is, can I enter remission with Hashimoto's? The simple answer is yes. It is something that can happen and something that I have seen. What's important to note in answering this question is that the pathology of Hashimoto's often involves both genetic and environmental factors. So if you're a person who really solely has Hashimoto's because of a genetic predisposition, then that's not quite modifiable. We can't change our genes. But if you're a person, and most people are, who have some environmental contribution to the Hashimoto's disease process, then those things can be modifiable, and that would include adhering to a healthy diet. Specifically in 2019, there was a study that the autoimmune protocol diet, adherence to that could help improve Hashimoto's, as well as regular aerobic exercise, which can improve balance of both our thyroid hormones and also our immune function. Next, the question is, my biggest issue with Hashimoto's is exhaustion. Can't shake it. Any tips? Well, yes. So first and foremost, of course, I don't know, I can tell you I have many patients who have Hashimoto's and talk about an exhaustion that is just debilitating with associated brain fog and just difficulty motivating to engage in life's activities and relationships. It can be really terrible. In order to improve this, the first thing is to make sure with your healthcare provider that you are getting the right kind of thyroid care and the right thyroid medication to make sure that you're having enough thyroid hormone in your body to support your body's processes. Thyroid hormone is so important for so many processes of the body, including our energy production and even allowing for proper blood flow to the organs of our body. I will say that while the majority of Hashimoto's patients and hypothyroid patients are on a T4 medication like Synthroid, some do better with an addition of T3, which can provide, in some patients, a little bit of extra pep in their step, a little extra energy. Of course, all of this goes along with good self-care, adherence to a really healthy, anti-inflammatory diet, regular exercise as tolerated, good sleep, good stress management. These are all things to talk about with your healthcare provider. Okay, so our next question is, what are thyroglobulin antibodies and how are they different from TPO antibodies? Okay, so to understand this, we'll have to just talk a little bit about the physiology of thyroid hormone production. In a nutshell, thyroglobulin is a protein that is in the thyroid gland, and in that protein is where our thyroid hormones are synthesized and stored. TPO stands for Thyroid Peroxidase, and it's an enzyme that essentially adds iodine molecules to pieces of that thyroglobulin protein to create thyroid hormone. So antibodies are immune cells that are meant to attack foreign substances like bacteria and viruses and fungi, but in some cases, like Hashimoto's, they end up attacking our own tissue, our own thyroid tissue in this case. So anti-thyroglobulin antibodies are antibodies that attack that protein in the thyroid that is needed for the storage and production of our thyroid hormone. And TPO antibodies are immune cells that attack the enzyme, the thyroid peroxidase enzyme, which is needed to add iodine onto pieces of the thyroglobulin molecule to create our thyroid hormone. Okay, so this question is, how does Hashimoto's affect pregnancy? Well, first, so people with Hashimoto's and decreased thyroid function in pregnancy may experience an increase in the production of their thyroid hormones during pregnancy that really just requires closer monitoring of thyroid hormones and possibly adjustments of doses of the medications that a pregnant woman might be taking for Hashimoto's. If Hashimoto's is untreated during pregnancy and there's chronically low thyroid function, there is an increased risk for complications during pregnancy, ranging from increased risk of miscarriage, to preeclampsia, to increased risk for cesarean section and preterm delivery, to postpartum hemorrhage, to even to neurocognitive problems in the newborn baby. Just a quick addendum to this is, so in pregnancy, for all women, the immune function is decreased just so that the woman can tolerate the fetus inside of them. In Hashimoto's patients and other patients with autoimmune disease, we say that these diseases can actually improve during pregnancy. But in Hashimoto's, it's been studied and shown that in many women there can be because of the rebound increase in immune function once the baby is delivered, there can be the beginnings of Hashimoto's at that point if it was previously undiagnosed, or worsening of the disease process if not appropriately treated. Should I be concerned about celiac disease if I have Hashimoto's? The short answer is yes. When people have Hashimoto's disease, there is an increased chance for developing other autoimmune conditions such as celiac disease. This is, would warrant investigation, especially if you're a person who notes usually GI symptoms with gluten consumption, abdominal bloating, diarrhea, sometimes nausea. But sometimes gluten consumption in people with celiac disease can cause issues with other systems like the thyroid and make conditions like Hashimoto's worse. So if that's something that you'd like to talk about with your healthcare or thyroid care provider, usually it's diagnosed with a combination of blood testing and then ultimately, definitively, an upper endoscopy with biopsies of the small intestine to confirm the diagnosis. So finally, the question is, when might you prescribe Lowdose Naltrexone? So the simple answer to this is that I think that any patient with Hashimoto's is a candidate for treatment with Lowdose Naltrexone, or LDN for short. Briefly, Lowdose Naltrexone is a medication that is still off-label in the United States, but is available and can be prescribed to help balance the immune system of patients with autoimmune disease like Hashimoto's. In my practice, I've found that the best results, the patients are most responsive to LDN treatment who have severe Hashimoto's disease and who also engage in behavioral modification, change in lifestyle to include weight loss if needed, by virtue of adherence to an anti-inflammatory Mediterranean-style diet and maybe that autoimmune protocol diet, which has been the best studied for Hashimoto's. Good regular aerobic exercise, sleep hygiene, and of course stress management.